For a case of neck pain, using our mnemonic old cards, we'll note the onset. When did your pain begin? Did it come on suddenly, or was it more gradual? And do you remember what you were doing at the time? For the location, we'll ask our patient as best they can to point with one finger. And during the palpation, we'll pay particular attention if it's paraspinal or if it's on the spine itself. For the duration, we'd like to know if the pain has been constant since it started, or is it more intermittent? If that's the case, we'd like to note the frequency. That is, how long does an episode of pain last, and how many episodes have you been having per day? Next, we can note the progression. Does your pain appear to be occurring more frequently or more severely? Or if there has been no progression, we'll also be sure to state that in our patient note to show that we've asked. To help characterize the pain, we'd like some descriptors. Has it been sharp or dull, among others? And since this involves the nerves, we can ask now or later in our review of symptoms of any radiating pain, numbness, tingling, or motor weakness, aggravating and alleviating factors, radiation, treatments tried, and severity on a scale of 1 to 10. And again, if there are no aggravating and alleviating factors or radiation, we'll also be sure to state that in our patient note to show that we've asked. For all cases, let's order a CBC, serum electrolytes, X-ray of the cervical spine, MRI of the cervical spine, and if we note any radiculopathy or myelopathy, as we'll see above, a nerve conduction study and an electromyogram. In a cervical muscle strain, our supporting points will include neck pain, and the onset will be after a sudden rotation, and it will be progressively improving. We won't see any radiculopathy or unilateral radiating pain, numbness, tingling, or motor weakness, and it can be alleviated by conservative management, including ice, NSAIDs, or muscle relaxants. In cervical osteoarthritis, also commonly referred to as degenerative joint disease or DJD by the surgeons and radiologists, we'll see neck pain. The onset here now is more gradual, and it will be progressively worsening. We can see a radiculopathy or a unilateral radiating pain, numbness, tingling, or motor weakness. Classically, it can be alleviated by rest, and our patient is typically older. And if we have any radiculopathy, we'll also note lower motor neuron symptoms, as the arthritis can be impacting the nerve at the nerve foramina, so we could see delayed deep tendon reflexes. In cervical disc herniation, particularly a lateral disc herniation, this will result in narrowing at the nerve foramina, so we'll see a neck pain, and now we'll have radiculopathy or unilateral radiating pain, numbness, tingling, or motor weakness. It can be aggravated by movements and alleviated by sitting still. And since the herniation is impacting the nerve foramen, we'll have lower motor neuron symptoms, including delayed deep tendon reflexes and a positive Spurling sign, as we'll see in our physical exam coming up. In cervical spinal stenosis, for example, an osteoarthritic bone spur, or a posterior disc herniation or ligamentum flavum hypertrophy, we'll have now narrowing at the spinal canal itself. So we'll have a neck pain, and now it will be a myelopathy or a bilateral radiating pain, numbness, tingling, or motor weakness. It can be aggravated by movements and alleviating by sitting still. And since it's impacting at the canal, we'll have upper nerve symptoms, including hyperreflexia, and we could also see a gait ataxia or urinary incontinence. In a cervical vertebrae fracture, we'll have neck pain, cervical and high-yield point tenderness. The onset tends to be sudden, and we could either have no nerve findings, a radiculopathy, or a myelopathy. That is, uni or bilateral radiating pain, numbness, tingling, or motor weakness. It can be aggravated by movement. We typically won't find relief by conservative management, since the fracture is the underlying problem, and it will also present nocturnally at night, and classically the patient is a postmenopausal female. We could have either lower motor or upper motor neuron signs, depending on if the fracture is impacting at the nerve foramina or in the canal itself. And this will result if in the foramen with delayed deep tendon reflexes, or if in the canal, hyperreflexia with possibly gait ataxia or urinary incontinence. In metastatic cancer, from either breast, prostate, lung, or even multiple myeloma, we can see a neck pain and with cervical and high-yield point tenderness. And again, we could either have no nerve findings, a radiculopathy, or a myelopathy. That is, uni or bilateral radiating pain, numbness, tingling, or motor weakness. Additionally, we can now have new systemic symptoms, including fatigue and characteristic for a cancer, weight loss, decreased appetite, or night sweats. We could also note a positive family history. And again, depending on where the cancer is impacting the nerve, if it's at the foramina, we'll have lower motor neuron findings, including delayed deep tendon reflexes, or if the cancer is impacting the canal itself, we'll have upper motor neuron findings, including hyperreflexia, gait ataxia, or urinary incontinence. And we'll add to our workup a breast exam, rectal exam, chest x-ray for lung cancer, and protein electrophoresis for multiple myeloma. And finally, in cervical osteomyelitis, we'll see a neck pain with cervical and high yield, again, point tenderness. And again, we could either have no nerve findings, a radiculopathy, or a myelopathy. That is uni or bilateral radiating pain, numbness, tingling, or motor weakness. And particularly high yield, if we're given fever on the vital signs, that can point to an osteomyelitis. We could have a history of skin trauma, abrasions, cuts, diabetes, or IV drug use. And again, depending on where the infection is occurring, if it's at the foramen, we could have lower motor neuron findings, including delayed deep tendon reflexes, or if it's in the canal itself, we could even see upper motor neuron findings, including hyperreflexia, a gait ataxia, or urinary incontinence. And we'll add here blood cultures. Okay, we'll begin our neck exam with hand sanitizer. We ask our SP if we could begin the exam. So we're going to introduce our mnemonic GI Prawn MSRP. We'll first verbalize the front of the neck and that there are no visible lesions. And then we'll come around the back and we'll verbalize that there are no lesions to the back of the neck. We're going to now palpate, and so please let me know at any point if you have any tenderness. So we'll start along the spine. And then we'll go paraspinal, left, right. A little pain here on the right side. Okay. Left again, right. Any pain?
Yeah,
a little pain here again on the right side. Okay. And can you please swing around for me? Assess range of motion. So could you please bring your chin down to your chest? Okay, let me know if you have any pain at any point. And now extend your neck as far back as you can. Okay, now tilt to the left side. And now to the right side, please. Any pain?
Just a little down
Okay,
the right side.
on the same spot?
Yeah.
Okay, I'm going to continue with MSRP. So for motor strength, please make a muscle for me. Okay, and resist me. So 5 out of 5, full reflection, and extend 5 out of 5 on extension. Great. Now we're going to do sensation to light touch. So please close your eyes and let me know if you feel this equally on both sides.
Yes, I do.
Okay. Now we're going to do a pinprick. So please let me know if you feel this on your left.
Oh, yeah, I feel
Okay. Now we're going to do the same thing on your right.
Not as much as the left.
Not as much. So we have decreased
Yes.
pinprick on the right. We're going to look at his biceps reflex. We'll place our thumb on his biceps tendon. And this would, his normal reflex would produce a 2+ response, okay? And if we were concerned for a case of B12 or hyperreflexia, he would have a 3+ response. Okay, you would see that. Assess his radial pulses as well. So we could do 1 at a time, 2 at a time if you're more comfortable, and we'll verbalize that it's a 2+ pulse, regular rate and rhythm. After we completed the MSRP for his upper extremity, we can now move down to his lower extremity. For motor strength on the lower extremities, could you please kick out? Okay, good. So that's 5 out of 5. Now could you please kick in? Good, 5 out of 5. Now we'll go into sensation. So please close your eyes and let me know if you feel this equally on both sides.
Yes, I do.
Okay, great. And now we're going to go into pinprick. So this is a pinprick. I'm going to start on your left side, and please let me know if you feel this all the way down.
Yes, I feel it.
Okay. And now I'm going to go onto your right side, so please let me know if you feel this.
Yes, I do, but not as much.
Okay, so we have decreased the pinprick on the right side. And now we're going to go into reflexes. So we could instruct them to relax, and we'll do a patellar reflex. So a normal patellar reflex would be like 2+, and then if we were concerned like hyperreflexia or B12, we would get a hyperreflexive response. So just relax, and you would see something like this. We can continue to demonstrate with the tap on his Achilles tendon. So we'd start right here, and we would get a normal reflex, and if this was a case of B12 and we were concerned about hyperreflexia, he would give us a dramatic response. Okay, you feel that. We could also test while we're down here a Babinski, so we could start on the bottom of the sole and go into the big toe. And note, if he had a positive Babinski, his toes would curl up. Pulse, we're going to go behind the medial malleoli, and we'll feel for the pulse, 2+ pulse. And then we could do the same thing on the left extremity and verbalize we have a 2+ bilaterally. Okay, now that we've finished with the lower extremity, we'll go ahead and hand sanitize again. Please now turn around and face forward again. And now we're going to begin the Spurling exam. So I'm going to apply a little pressure downward on your left side and then your right, and please let me know if you have pain at any point.
That's on my right.
On the right hand side? Okay. Thank you. Could you please stand up and walk straight? And come back. Any pain?
No.